Mr. Holland, members of the board, thank you again for an opportunity to update you on our overall vaccination strategy. Case rates and percent positivity test results have dropped significantly and have reached levels that we haven't seen since fairly early on in the pandemic. I believe the vaccination campaign has made a tremendous positive impact. So I presented a similar slide during my update last month, showing the flow of vaccine into the health district through the various channels of distribution. The numbers in red show total doses and percentage of total doses for each of the channels during the past 2 weeks, which again capture our current pattern pretty well. The numbers in blue indicate the percentage of total doses for each channel for the 2-week period leading up to my presentation to you a month ago. These are the same values that I shared last month, and I'm offering them again to highlight a few changes in how vaccine is entering this health district. The main one I want to point out is the second bullet point, that more doses, 60% of the total doses coming into the district, are heading to pharmacies this month compared to 48% of the total last month. This can partly be attributed to the reduction in doses going through health department operations like the Fairgrounds pod that has been winding down. We can anticipate more and more doses flowing through pharmacies moving forward. Here are some general updates covering vaccine eligibility and vaccine delivery approaches. I'll also cover the focus of health district vaccination operations over the summer. So vaccine eligibility has increased to include adolescents age 12 and over. So far, there appears to be ample capacity through pharmacies and medical practices to meet the demand for vaccinations in this age group. Again, I'll restate what I mentioned last month. Medical providers and pharmacies are the primary vaccine delivery means in this health district as large-scale vaccination operations wind down. A case in point is the VSU Community Vaccination Center, which will be demobilizing this coming Saturday, May the 29th. That site has delivered more than 95,000 doses since it began operations on March 17th, making it the second largest site in the state, trailing only the 135,000 doses administered by the Prince William County Community Vaccination Center. The focus of health district operations shifted away from mass vaccination events early this month toward providing vaccines to vulnerable populations, including communities of color. There are a number of components to this work. With respect to outreach through the state, we've been able to secure the services of community canvassing teams who are going door to door in areas we're targeting in advance of any scheduled vaccination event. The canvassers are providing COVID-related education, plus helping direct those interested in receiving vaccine to an upcoming clinic. We're also working to increase the number of sites we're offering vaccines to, beyond the 3 places of worship we've been visiting since early this month, to include parks and other frequently trafficked areas. We're exploring a model of providing vaccine in locations in close proximity to groups of businesses who might employ individuals we're reaching out to, as well as others who might want a vaccine. Mobile operations are critical to many of the community focus efforts I just described. I'll talk about one mobile asset that we're using in just a moment. The last thing I want to mention regarding strategy is our effort to use better, more readily available data about vaccine uptake at the census tract level. We see this type of work as an ongoing ground game that will take time, dedication, and flexibility. And we intend to use data to help us direct resources more effectively. We're just getting started in what will be a longer-term operation. So VSU has been a committed co-laborer in the fight to end COVID. They've dedicated, as I mentioned before, incredible resources to stand up and house the Community Vaccination Center on the VSU campus. And leadership there has also made one of their mobile vaccination units available to this health district to deploy as we see fit. VSU is providing a driver, and health district staff handles registration and administers the vaccine. Members of the Chesterfield Fire EMS Incident Management Team round out our team and provide on-the-ground operational support. They've also been instrumental in scouting prospective sites and helping to secure any necessary permissions. Anyone interested in receiving a vaccine who is eligible to receive one can simply walk up to a mobile unit team and fill out a consent form. The mobile unit will be in Rockwood Park tomorrow from 3 p.m. until 7 p.m., offering Pfizer vaccine to anyone 12 years old and older. Adolescents, of course, will need a parent or guardian to accompany them to fill out a consent form. The unit will return in 21 days to provide a second dose, though individuals can now go on to Vaccine Finder to get their second dose at a location convenient for them. In addition to canvassing efforts that I mentioned earlier, there are a number of outreach modalities that are being deployed to highlight the mobile clinics and other small-scale clinics that we're operating, including traditional media releases and the new methods that Dr. Worsley highlighted earlier. Again, we're looking at a number of different approaches to get vaccine into communities of need, and mobile opportunities are going to be key to this. We're continuing to look out for innovative practices that have worked elsewhere, and we'll adapt our approach as we continue this campaign. Overall, things are clearly headed in the right direction. I've listed here some noted trends as well as factors we'll continue to monitor as we move forward. First, supply is still outstripping demand. The drop in age eligibility hasn't stressed the dispensing venues available to the public, like pharmacies and providers. We're really excited about the new opportunities that mobile clinics open up to us. So far, our experience has been very positive, and we'll continue to monitor throughput data relative to our community fixed sites as we evaluate our longer-term strategy. As I mentioned earlier, we now have access to targeted canvassing resources in communities of need. This, along with other communication modalities, should improve our advertising and vaccination recruitment efforts. We'll monitor progress there. We're learning, of course, that easier access is best. All of our fixed community vaccination sites allow both walk-up and pre-registration modalities. As I mentioned earlier, mobile clinics are walk-up. Our strategy team includes members of the Chesterfield Fire EMS Incident Management Team who have been incredible partners. They've been absolutely invaluable. We're all agreed that we've reached a point where we feel confident we can begin a gradual drawdown of IMT resources so that they can continue to do the work that they do best. In closing, I believe teamwork has moved mountains in this district. All the signs are telling us that we're approaching the finish line to what has been an arduous journey.